Arterial diseases objectives. To understand the nature of occlusive arterial disease and its associated symptoms and signs. To able to assess acute and chronic arterial insufficiency and know treatment options. To know about gangrene and its management. To know other arterial diseases like aneurysms, arthritis and vasospastic diseases and AV fistula, arterial occlusion. Occlusive arterial disease. Types: acute arterial occlusion, chronic arterial occlusion, acute arterial occlusion. Causes: embolic, thrombotic. Heart diseases: atrial fibrillation, mural thrombus, post-ME. Rheumatic valvular heart diseases. Paradoxical embolism, venous thromboembolism due to patent foramen navale. Arterioarterial embolism, dislodgement of atheromatous plaques. Angiographic procedures. Accidental intra-arterial injection, ergot, thiopental. Trauma, embolism, brain, MCA, retina, amaurosis, fugax, mesenteric vessel, spleen. Kidneys. Lungs, pulmonary embolism, acute arterial occlusion embolism. CF5Ps. Pain, paralysis, pallor, pulselessness, paresthesia, relationship of symptoms to the site of obstruction. Aortoiliac obstruction, iliac obstruction, femoropopliteal obstruction, distal obstruction, ankle pulses absent, calcification in both buttocks, thighs and calves, femoral and distal pulses absent in both limbs. Impotence. Bruit over aortoiliac region. UL claudication in thigh and calf buttocks. Bruits over iliac region. UL absence of femoral or distal pulses. UL claudication in calf. Femoral pulse palpable with absent UL distal pulses. Femoral and popliteal pulse palpable. Claudication in calf and foot. Arterial stenosis. General investigations, CBC, ESR. Plasma fibrinogen, protein, electrophoresis. Glucose blood and urine. Lipid profile. Doppler USG blood flow detection. Duplex imaging. Echocardiography. Arteriography. DSA. ECG, handheld Doppler. Color duplex. Arteriogram. DSA. Angioscope. Treatment. Embolic arterial occlusion is an emergency. Thrombolysis, immediate intravenous heparin 5000 U. To prevent distal and proximal extension of thrombus. Contraindications. Recent stroke. Active peptic ulcer. Bleeding disorders. Pregnancy. Hydration. Embolectomy. Thrombectomy. Fogarty catheterization for removing proximal and distal extension of thrombus. Postoperatively heparin and oral anticoagulation. Intraarterial thrombolysis. Only if ischemia is not so severe that immediate operation is mandatory, it is possible to treat thrombus or embolus by intraarterial thrombolysis. Agents: tPA tissue plasminogen activator, streptokinase, urokinase. Identify and treat the basic cause, SFA thrombolectomy. Removed thrombus. Arterial catheters. Chronic arterial insufficiency. Etiology: atherosclerosis, Buerger's disease, arthritis, arteriosclerosis, diabetes. Risk factors: hypertension, strong family history, smoking, lipid abnormalities, chronic limb ischemia. Ischemia of the lower limb may be minimal to critical, also called chronic arterial insufficiency or peripheral vascular disease (PVD). Clinical presentation: intermittent claudication, commonest complaint, fatigue, aching or crampy pain occurring with exertion and relieved by rest, reproducible at the same distance. Claudication distance at which the pain appears. Rest pain. Critical ischemia, severe ischemia with actual or potential tissue loss. Signs of chronic ischemia: loss of muscle mass/bulk, loss of subcutaneous fat, skin shiny, loss of hair, brittle nails, gangrene and ulcers of foot, ? Gangrene. Death, often with putrefaction of macroscopic portion of tissues. Varieties according to the cause. Secondary: thrombus in atherosclerotic artery, atrial fibrillation embolus, arthritis from neuropathy, Buerger's disease, Raynaud's disease/ergotism causing arterial shutdown, intraarterial injections, thiopentone and cytotoxic materials. Gangrene. Primary: infective boils, carbuncles, gas gangrene, gangrene of scrotum, Fournier's gangrene, traumatic crush, pressure sores and constriction grooves. Physical burns, scalds, frostbite, chemical radiation and electricity. Venous. CF. Pulseless, painless, functionless, with color change. Lax capillary refill and venous return. Black, brown, greenish black. Gangrene. Clinical types: dry and moist. Dry gangrene. Desiccated tissues, part becomes dry and wrinkled, discolored from disintegration of Hb, and greasy to touch. Moist gangrene. When venous and arterial obstruction is present, when artery is suddenly occluded by a ligature or embolus, and in diabetes. Infection and putrefaction is present. Part is swollen and discolored. Crepitus may be present. Gangrene. Separation of gangrene. Separation by demarcation. Separation without demarcation. Vague demarcation and skip lesions. Treatment of gangrene. General principles: limb-saving attitude, cardiac failure, atrial fibrillation, anemia, nutritious diet, control of diabetes, analgesics. Local treatment: dry. Protection of pressure areas, clean yes. Varieties of gangrene. Diabetic gangrene. 3 factors. Trophic changes from peripheral neuritis. Atheroma of arteries causing ischemia. Excess sugar decreases resistance to infections, especially fungal infection. Direct traumatic gangrene. Bedesso's decubitus ulcers. 5 factors. Pressure, injury, anemia, malnutrition, moisture, pressure sore. Gangrene. Indirect traumatic gangrene. Interference with blood vessels from pressure by a fractured bones / strangulation. Thrombosis of an artery. Ligation of an artery. Poor technique for digital anesthesia. Ergot claviceps purpurea. Fingers, nose and ears. Seen in migrant sufferers. Physical and chemical cause of gangrene. Frostbite, cold plus wind. Damage to vessel wall with transudation and edema. Pain initially, later painless and gangrene. Trench foot, cold plus moist plus muscular inactivity. Ill-fitting boots. IV injection of thiopentone. Drug abuse. Chemical gangrene, carbolic acid, phenol. Frostbite. Aneurysms. Aneurysm's dilatation of a localized segment of the arterial system. True, all three layers involved. False, single layer of fibrinous tissue as the wall of the sac. According to the shape. Fusiform. Saccular. Dissecting. Etiology: traumatic / atherosclerotic / syphilitic / collagen disease, Marfan syndrome, mycotic bacterial. Aneurysms. Symptoms due to expansion, thrombosis, rupture or release of emboli. Symptom relate to the vessel affected, the site supplies or the tissue compressed. Clinical features. Intrinsic expansile pulsation along the course of an artery. Proximal compression decreases pulsations. Palpation thrill. Auscultation bruits. Extrinsic neighboring or distal structures are affected. Nerve. Veins. Tubes, trachea, esophagus, DD. Swelling under an artery, cervical rib, subclavian. Swelling over an artery, pancreatic cyst. Pulsatile tumors, sarcoma, osteoclastoma and metastases from hypernephroma. Abscess. Serpentine artery, innominate, carotid. Aneurysms. Abdominal aortic aneurysm, commonest large vessel aneurysm. 2% population. 95% atherosclerotic. 95% below the renal arteries. Symptomatic / asymptomatic. Symptoms: back pain, sudden, mild, sudden, severe. Aneurysms ruptured =A anterior posterior. Free bleeding into the peritoneal cavity 20%. Retroperitoneal hematoma 80%. Profound hypotension. Severe pain. Aneurysms. Investigation. USG abdomen. CT chest and abdomen. Aortogram. Aneurysms procedure: open surgical procedure. Endoluminal stent graft procedure. Complications. Respiratory. H''G.T. Colonic ischemia. Renal failure. Infection of the graft. Sexual dysfunction. Fistula formation. Spinal cord ischemia. Peripheral aneurysms. Popliteal aneurysms, most common femoral iliac. Ascending aorta and arch, AVF, communication between an artery and vein. Congenital, acquired. Trauma, penetrating wound or sharp blow, surgical. For renal failure. Structural effect: arterialized veins. Dilated tortuous veins. Physiological effect: increased VR, increased VP, increased HR. Increased CO. PP high. LVF. Cardiac failure. Cong fistula, overgrowth of limb. Persistent ulcer due to distal ischemia. Question mark. AVF clinical signs: pulsatile swelling, thrill on palpation. Bruits on auscultation. Dilated veins. Nicolet-Doni-Branham's test: decreased thrill, reduction in size and bradycardia on pressing the artery proximal to fistulae. Treatment: embolization. Ligation of feeding artery. Surgery: separation of artery and vein. Arteritis, thromboangiitis obliterans / Buerger's disease. Small and medium-sized arteries. Occlusive disease. Thrombophlebitis of superficial / deep veins. Raynaud's syndrome, male, young patients.